Hi everyone, my name is Alyssa Strickland, and for this week's discussion forum, I will be discussing suicide prevention versus the right to die with dignity movement. When I first read this week's discussion prompt, I was very unsure how to answer because this is a very touchy topic for most people. I know it was for me, because there's no real straight answer. There's no right or wrong. It's a very touchy topic, for me anyway. So first I'm going to start by explaining suicide prevention. Of course, you don't want anybody to just go and kill themselves. You definitely don't want that. You want to prevent against that, between if you're just depressed or you're sad or you're hurting and you feel like it'll never get better, that's not a reason to kill yourself. And that is definitely something that needs to be avoided. However, the right to die with dignity movement, if you are terminally ill, if you have cancer, if you have a heart disease, a lung disease, if you have something terminal that you don't really want to try and get treatment for, that you don't want to go through chemo, that'll make you sicker before it gets better, and there's a chance that it might not even get better, I think that patients should have that right. My grandfather, he had cancer, and he didn't do chemo because he always said that life was quality over quantity. And I believe that. So there's also the predicament with letting someone just carry out their days or physician-assisted suicide, which is once again a very touchy topic. You have to look at all factors in play: mental health, other issues that they have going on. A patient who is terminally ill and wants to die, you have to read into that. You can't just pull the plug, or not really pull the plug because they're still alive. But you have to look at all factors in play when determining if physician-assisted suicide is the way that these people want to go. I think that if someone is terminally ill and they want to go peacefully, that is their choice and that is their right to do so. But I also think that if there is chances of them getting better and not having to suffer, then they should also look at mental health factors and make sure that their mental health is not the reason that they are wanting to kill themselves. I think that cultural values and religious values play a big part in this. As bad as it sounds, a lot of cultures, it can be shameful to want to kill yourself, even if you are terminally ill. And a lot of families might receive shame and other sorts of, I don't want to say discrimination, but like hate, I guess, from other people because of someone in their family killing themselves. And as bad as that sounds, it happens. People will shame families for someone committing suicide or killing themselves, even if it is physician-assisted. And there's also religious values. A lot of religions believe that it is a sin to kill yourself. And so that's another factor that is at play. A lot of people think that you'll go to hell or whatever your religion says after you die if you kill yourself, even if you are terminally ill. It's all about God's timing, not your own. Overall, this was a very touchy topic for me, and honestly, I don't know how to give a straight answer to this question. I don't know what is right or what is wrong when it comes to this, because it all depends. It's a case-by-case thing, in my opinion. I don't believe under any circumstance, if someone is healthy, that they should be allowed to kill themselves, or if they are terminally ill and they want to at home kill themselves, I don't think that that's okay. But physician-assisted suicide, if the terminally ill patient wants to do that, I think that is something that can be considered if there's no chance of getting better and to prevent further suffering. Thank you.